First of all, just thank you so much for the invitation. It's really an honor to be here. I'm so impressed with your program and what all of you are doing, and just so pleased that you want to involve patients in this. Which is a very exciting process, so thank you. So I'm Rebecca, and I've had dry eye disease for close on 20 years now, and started the Dry Eye Foundation, and just have a passion for finding better help and better solutions for people that are struggling with this. One of the things I've spent the most time on over the years is just listening to stories of how people came to the place that they are, how dry eye happened to them, what their journey's been like through it, what the medical world has and hasn't been able to offer them, and just what the path and the trajectory look like. And we're hoping as an organization to be able to craft more and more ways to both help people towards solutions earlier in their journey, and hopefully in the longer term do some work in prevention as well. So again, thanks so much for having me. And so I have friends with me. We've got Ruth and Mandy and Christina, and just so happy that they were able to join. They've got just a lot of really well-formed thoughts about this experience that I think will be really illuminating. So happy to just move forward with questions or whatever else you'd like.
Perfect. So because you could already saw the questions in advance, I don't know if you already know more or less how, because otherwise we just are free, all of you, to contribute to the answers, and I think that's the best. So we can already move on, and maybe the first person who will make a question, I think, is Bao. If you want to also introduce yourself at the beginning, thank you.
Yeah. Hello everyone. Can you hear me right? I am Bao Chen. I'm a PhD student in University Hospital Cologne. So my question is my question is so like actually when I heard about when first time I heard about when pass forward the email, so I Google about you, like Rebecca Tetris, and I know about Dry Eye, like the website. I forgot the name, but Dry Eye Foundation. So many people share their story. So my questions actually is like my question is very simple. Like how do you define about dry eye disease? So my question is actually I want to like clarify. Like I want to see like what you feel at the first time. Like you didn't see it clearly, your vision, or is a problem related to your pain or anything special, any kind of signal at the beginning, like how everything starts. So I know it's not like a good experience, but yeah, it's just for the scientific view. So thank you. Yeah.
Okay, I'd love to field this, but I know my friends also have lots to say about this. Just what is dry eye disease? How does it play out? How does it start? What does it look like? So in the questions that I received by email, there was a mention of the TFOS DEWS II definition, right? And so you're trying to find the patient version of that. What does that look like in real life, right? So I was actually a participant in the process of TFOS DEWS II. They had this meeting in Seattle in 2016 where everyone on TFOS, I don't know if you guys are familiar with this, but there were 150 experts from around the world that got together and spent 2.5 years creating the DEWS II report. So we had this big meeting in Seattle, and it was the most contentious part of the DEWS process, coming up with a definition for dry eye, right? It went on forever. Everyone disagreed. And that's just the medical world, right? As patients, we've got some different views. But some of the positive things that came out of that TFOS process were they added the word multifactorial, which means, there's a lot of contributors. And I think that's very much reflective of our experiences. Hardly any of us have just like one thing that seems to have caused the problem. Then they added the word symptoms. I don't think it's enough for us as patients. Symptoms are everything. It's what am I experiencing 24/7 in my eyes and how it's affecting my life, right? And then they added language about the neurosensory part, which is really important because I at least think of this very much as a pain syndrome. And in TFOS DEWS II, they introduced a lot of new information about pain and sensation. But just kind of backing up to my personal experience, I'm not fond of the name dry eye disease itself at all. I feel like that name limits the usefulness of any definition that you put on it. You label something dry eye and it just immediately sounds trivial. We can't get to the real meat of it, I feel, when it's got that kind of name. So there are terms that I like to use instead that I feel describe our experiences better. And that's kind of two in parallel. It's ocular surface disease on the one hand and ocular surface pain on the other hand. Because dry eye does have those two separate pieces and they don't correlate well. They have to be thought of independently, I believe. We all have different ocular surface disease experiences. And symptom-wise, those symptoms can be all over the map, no matter what the disease status is. So you can have very intense symptoms, but your eyes don't look that bad in an exam. You don't have a lot of clinical signs, right? You can have, I've talked to people that have massive clinical signs and almost no symptoms because they've lost so much sensation in their corneas, right? So to me, it's a world of disease and symptoms thought of separately. And that kind of tracks with my personal experience of it. So I got dry eye from LASIK 20 years ago. And there's been no point along the way when some doctor has looked at me and said, oh my God, your eyes are so dry. I don't have really strong clinical signs, but I have very strong symptoms. If you're familiar with the OSD symptom survey, for the last 6 months, I've been scoring in the mid 80s on that. My eyes hurt a lot all the time, despite everything that I do for them, right? But I don't have really strong signs of disease. I don't know how well that answers the question. Let me pass this off to who else would like to jump in?
Yeah, I'm happy to jump in. I assume you can hear me okay because I'm sat outside, which is, yeah, wearing my special moisture chamber glasses so I can actually sit outside. I mean, just to echo what Rebecca says, one of my biggest bugbears is dry eye disease. Just sounds so innocuous. Like, you have dry skin, you put some moisturizer on it. You have dry hair, you buy the new magic conditioner. You know, dry eye disease sounds like the sort of thing, you know, you could use it to describe what the man in the street would say is, oh, you know, if I work at my computer for 8 hours, my eyes feel a little bit itchy and I put some over-the-counter drops in and I'm fine, which is obviously one end of the spectrum to then the other end of the spectrum where sort of from a personal point of view, you know, I'm off work sick at the moment because I cannot do my job, which we'll come on to in another question, I guess. So I have issues with the definition. Obviously, you know, I think most dry eye patients are good self-advocates, so a lot will go out and read. So, you know, we understand the difference between an aqueous deficiency and a meibomian gland dysfunction and a mixed etiology. And I mean, I have both. I'm mixed aqueous deficiency and meibomian gland disease. You know, most of us understand that it's an inflammatory process, and obviously, yeah, a vicious cycle of inflammatory cytokines, you know, causing more problems. But again, I do think there's a big offset between sort of perception of doctors of what your eye looks like and what you feel as a patient. And for those of us who have very soft clinical signs but a lot of symptoms, I think it makes negotiating treatment quite difficult.
One of the things that gets overlooked a lot in understanding dry eye, I think, is vision symptoms or vision impact, not necessarily reduced visual acuity, but what dry eye does to our ability to see, to just navigate daily tasks. Of Christina and I were talking a little bit about that yesterday, and do you want to jump in on this, Christina?
Sure. More anecdotally, yeah, I mean, there are these visual issues that I experience, and every time, I mean, I've brought them up for the last year to my ophthalmologist and my optometrist, and every time I bring it up, they get overlooked or explained away by something within this dry eye definition. It's like, oh, blurred vision. It's just blurred vision. And I say, in my head, I'm getting better at advocating for myself in person, but I'm the patient and I know what I'm experiencing better than you do. And it's not just blurred vision. There is something else going on, but I think because the definition of dry eye is limiting, is the word that I think of, these other issues that we experience get lumped into or seen through the dry eye disease definition, and there are other issues that outside of what the clinical definition is that we experience.
I think, your vision can be great on the Snellen chart, but if you can't keep your eyes open, you're not seeing very well to do your job or to drive or anything else. So we get a lot of vision impact. Mandy, anything you want to add?
You're on mute, Mandy.
Thank you. I think you guys covered it very well. I can jump in on the next question. I think the big thing that everyone pointed out is to not simplify or trivialize it, and that it is really different for everyone. I don't think there's one way that you can define it to encompass every person that's out there. So that's the difficult part for all of you, is that it's so wide-ranging, the causes, the symptoms, the clinical, what the doctors are seeing clinically. They'll be like, oh, your eyes look fine. No, I mean, great, they look fine, but they don't feel that way. So anyway, I can jump in later.
Can I ask one more small question? Yeah, because I'm gonna read so when I check the website, so I read lots of people write about dry eye disease. So they have dry eye, and then when you mentioned that you have a symptom like such as you felt pain, or you feel like something happened. I don't know how long, or is there any kind of incubation time, or like it's happened everything at the same time, or it take you 1 year, 6 months. So I read a story like one get a LASIK, and then after several weeks she has a problem with the visual acuity, and then after 1 month or 2 months she got kind of pain or something, and nobody believed her because her eyes really good, kind of like the visual is really perfect, but she has a pain and nobody can confirm it, and take her like 10 years, 5 years to find that's dry eye disease. Of course, the name is really like make no sense to the real disease, kind of the seriousity of the disease.
So I can talk a little bit to that. So whether it comes on gradually or whether there's an incubation period, I think again it's different for everyone. For myself, I am 43 now, and I was diagnosed when I was 19. So I've had this for majority of my life. I mean, yes, majority of my life. 24 years now. It's crazy. But first of all, every day is different. Second of all, so you don't know, like, am I going to wake up and feel okay? I mean, I always know I wake up and feel bad that morning, but which days am I going to have a really bad day? I don't know. So it's hard to plan lots of things. This kind of goes into the next question. But for me, there isn't really an incubation period. For me, it came on strong right away. Like, I used to wear soft contact lenses, and I was just dumping saline in my eyes like all day. This was my sophomore year undergrad, or do you guys call it uni? I don't know. So I was in my sophomore year, it just like came on strong, and I have severe aqueous deficient dry eye, so I just don't produce tears. I have a little bit of MGD. So, you know, we all are coming at it from different causes and different directions, but in my daily life, it's just trying to do what I can to manage and learning how to manage. So I don't know if that really answers your question. And I think it's different for everyone. Again, I'm sorry, I'm going to say that a lot.
I want to just add to that with, you know, we've been spent a year and a half conducting a big survey of our community, and we haven't analyzed all the data yet. We're barely getting started, but this was a topic that we addressed in there. Was how did this thing start? Was it very gradual and then got worse? Was it an overnight start? Was it kind of mild and then it kind of dropped off a cliff? And it's been really interesting to see the variety of responses. But one of the things I've always seen both in the survey data and just in my personal interactions with people over the years is even for people where it all started very suddenly, often when you really pick apart their story, you can find signs and past history that are clues to it. So it's like the disease is growing and increasing, but the symptoms may start very suddenly. You can just kind of trace back causes and things to earlier, but then a lot of people that I talk to just, it basically came out of a clear blue sky. It happened overnight. They became real severely symptomatic.
I'll just chime in and say that that was my experience. I was diagnosed with MGD in 2017, though I suspect I probably had it for years, but it was exactly as Rebecca described, where I literally remember in February of 2017 waking up with dry eyes. They hurt. I couldn't understand the pain, and my life has been different ever since. Every day I wake up in pain, as I think everyone, every patient speaking on this panel can relate.
I think exactly the same. I woke up, I'm reasonably new to this. I was only diagnosed 6 months ago. So I woke up on Christmas Day 2020 with an acute loss of visual acuity in my left eye due to kind of exposure keratopathy and pain, a lot of pain. And I've had the pain ever since. But then if I look back, I stopped. I'm 46 now. I stopped being able to wear contact lenses in my early 30s because my eyes were too dry. I suspect I've had this for a very long time because my meibomian gland loss is such that, you know, you don't just lose half your glands overnight. You know, it's impossible to get that degree of damage so quickly. I suspect the body is just very clever at not noticing symptoms until it suddenly notices symptoms, and then it's unable to stop noticing it because suddenly it's there. And that certainly was my experience. I suspect my eyes have been dry for months, and I just have been really busy working through a pandemic and just simply didn't notice until I did notice. And then I noticed a lot. So I think it's very common. So whilst many of us have an acute onset, again, I doubt it is truly acute. I suspect you are subclinical for a while, and then suddenly you become symptomatic.
That's really actually, I'm sure, somewhat true in my case too, even though it was from LASIK. That's where all my pain and everything started. But if I looked back, I look at the problems I had. I wore soft contacts for 20 years and some issues that I had with those. Then there's other, you know, I have nocturnal lagophthalmos. I never knew what that was or that I should care before I got dry eye after LASIK. Also hypothyroid, and there's just all these things. You can look back and see them kind of as pieces contributing to this giant explosion that's triggered by something new. Any more follow-ups, or are we ready to move on to the next?
Yeah, I think, thank you. I think that Bao is more than satisfied with the answers, and all of us. So we can move on. Yeah, Luna, I think.
Yeah, hi, good afternoon to everyone. I'm based in Spain at the University of Valladolid, and I wanted to ask you to which extent dry eye influence your daily life, And what would you advise to other dry eye patients, like how to behave or manage it?
I can jump in. That's okay.
Absolutely.
So I would say that dry eye impacts every part of my daily life. As I was mentioning, I got it when I was was diagnosed when I was 19, and as a 19-year-old, it was really hard for me to deal with because I'm in college, having fun, we're so vain, right? Like makeup, that time glasses were not cool, and at least in America. And so I had to start wearing glasses. I had these like hideous glasses that I would only wear after I took out my contacts. I wasn't able to wear makeup, and then just studying. Like I had all these like goals and dreams and aspirations of what I was going to do with my life. And, I have a very good work ethic, but when you're staring at books or screens or whatever and not blinking as much and having to read and having to use your eyes, it's really hard to focus. So my grades significantly dropped. I also want to fix things. So I have a very intense personality, and I'll get like stuck on things. And so I just went to the medical library and read all about like everything I could find about dry eyes instead of like focusing on my classes. And so I was trying to figure out how to fix the problem myself, and it overtook everything. And then I became depressed. I think a lot of people do. I definitely have depression and anxiety issues. And if I did not take meds for those, I would be unbearable to myself and others, I'm sure. And, but now in my daily life, it just takes so much time. I mean, like I get up in the morning, I do warm compress, they say like 5 to 10 minutes. Well, it takes much more time out of your day just to get your eyes working. Like for me, mornings are really hard. Nights hard too, but I can fall asleep. I don't have to get up and face the day and go to work. And so mornings are hard. There's lots you have to do. Then I'm at work. I wear these really cool glasses. I'm going to show you. So these are moisture chamber glasses, and I wear them. They like seal to your face. I have some clear lens ones and some sunglasses ones for outside. There's like this little foam gasket thingy. Wiley X's are my brand. There's other brands out there, 7i, that a lot of people use, but I wear those all day when I am looking at the computer. I wear them at work. My coworkers will come over and I'll just be like, yeah, my eyes are dumb, or my eyes suck, or whatever. That's like my quick explanation to people because I don't want to get into it. So then I'm also like self-conscious, there's just so many things. You're always putting in eye drops. At the airport, I'll wear those, and on the airplane, and people are like, I just have all these like things going through my head. Are people looking at me? Like I have to get over it, and I've gotten pretty good at getting over it, but it took a really long time to get there. So it impacts every facet, because I'm, I went to law school, and then I worked as an attorney for a while, and now I work in our state budget office, and I work on policy and the state budget issues. And so I'm staring at a computer all day reading, and that's my career. And that was the career path that I chose, is working on policy and law. And it's just reading. And so I am determined to not let it end my career, but I can't wait until, we were talking about this yesterday, until I can just I would like to just teach meditation and yoga, so I can be in like a hot space, or close my eyes all the time. And like, it would be so much easier to get through the day. It's just hard. And then I've canceled, you know, social activities. I don't want to, like, I don't call into work, just that's not, again, my work ethic, but social activities, just being able to stay up late. I don't wear makeup, like maybe like once or twice a year I wear it now. And I mean, that actually takes a lot of time out, like gives me a lot of time back in my day, not putting makeup on or having to take it off at night. I know you guys know all about this. So, I mean, the men wear a lot of makeup. So anyway, then at night you have to do warm compress. I wear like this mask at night. I mean, it impacts every single like part of your day. And then you're always thinking about it because it's your eyes. It's your eyes. You know, you use your eyes for everything. And so what would I recommend to someone suffering from this disease? I think that joining a support group, finding a buddy, that's one of the things we're working on, is hooking people up with who are new to support group or new to dry eye world, having them start talking with someone who's more experienced in the dry eye world, and then, sorry, I have something in my eye. That's the other thing, you get shit in your eye, stuff in your eyes all the time, and my eyes don't wash them out, so I have this sensation of stuff being in my eyes all the time. So I would recommend joining a support group, having a buddy, because doctors don't have time to tell you everything that you need to know, and they also get really frustrated with dry eye patients because there are so many causes, and there's not one end-all be-all cure that applies to everyone. I would also suggest that people see a therapist, get some mental health help, because so many people have problems with the mental health aspect of it. And so those are the two main pieces of advice. Also, that it's going to be a journey. It's not going to be something that's fixable overnight, unless you guys can change that. That would be great. So anyway, yeah, I guess I'm done. I'm more informal than everyone else. Everyone else is so well spoken, and I'm just kind of informal, sorry.
You're just very real with it, which I just love that. I think all of us in our group have had a lot of work impact from dry eye, and that's such a key thing, because work is it's what brings meaning to a lot of our lives. It's how we support ourselves. It's our financial future. So having work time be messed with by how our eyes are feeling is a really big deal. And I think a big part of the kind of mental health impact of dry eye too. For me personally, something Mandy mentioned, I think is a big thing. It's this constant awareness. It's how much you think about your eyes. To me, that's like the measure of when I'm going through a bad phase or when I'm better. In a better phase, when I'm more stable, dry eye is always there, but it's background noise. I can work around it. It's just something that's there. It's not at the forefront of my mind. When things are flaring, and I've been going through this, I kind of mentioned the last 6 months, it's never away from the front of my mind. It messes with your concentration. That's one of the big impacts for me at work. I just can't think well and sustain really good thought processes when my eye pain is above a certain point. It just kind of pushes everything to the side. It's just a constant awareness. Ruth has had a lot of big work impact. I want you to tell that story.
Yeah, I mean, from someone who's reasonably recently diagnosed, I would say the impact on my life, not to sugarcoat it, has been devastating. I think I described it to my general practitioner, my GP, as I spent a period of time actually being in mourning for my former life. You know, I want my life pre-December 2020 back. I want to not have to think about my eyes every single minute of every single day. And I want to be able to just, you know, go out to the shops and not think twice about how I'm going to do it. So that for me, I'm still not through that period of readjustment. I've also, as well as the dry eye, I've been diagnosed with a corneal neuropathy in my left eye. And I get intense pain. And one of the things that triggers it is computers. Obviously, I'm wearing dark glasses, and you know, I try not to spend too much time looking and focusing on the screen. So the way it's impacted me is predominantly my job. I'm not at work at the moment. So my job, I'm a doctor. I'm a radiologist. So I'm sure you know, doctor who interprets X-rays and scans. My areas of specialty are chest. So obviously, when you're looking at imaging of the chest, you are looking at structures which are 1 or 2 millimeters. You know, we would start following up lung nodules once they get to 5 millimeters. Those are small structures, and you're generally comparing like with like. At my job, I will have 4 computer screens in front of me, 2 diagnostic monitors, and 1 or 2 PC screens where my reports dictate. So that is probably one of the most eye intense things you can do. My other area of specialty, which I didn't share with the group last night, is I'm a post-mortem and forensic radiologist. So I look at scans of the deceased to determine cause of death. Now, if you're scanning a recently deceased patient from head to toe, that's probably about 1,200, 1,500 individual slices. So looking through all of the body, it's incredibly eye intense. So I've not worked. I went off work in January because I just couldn't do it. I just couldn't look at a screen. I had a failed phase return and went off again in March, and I've not gone back. So I've been a doctor since 1999. I've been a radiologist since 2004. And a consultant for 11 years. So that is my entire life revolved around getting to this point. I'm now looking at not being able to do my job again. I certainly won't be able to do it full time. I just don't think my eyes will cope with it, and the risk of progression through that level of eye intensity. So I'm either looking at going back to work part-time or leaving the National Health Service, leaving the profession and doing something completely different. I haven't decided yet. I will probably try doing it part-time and see how I go. But these are major life-altering decisions. If I do either of those things, there is the very real chance I will have to sell my house because I won't be able to pay the mortgage because I'm the breadwinner. So, you know, these to say, dry eye disease, it trivializes something which has major life impact. It's impacted, as Amanda said, the impact on your mental health is huge, because you go from being someone living a very normal life to living a very disabled life to many degrees. I mean, I'm coming to you from a garden because I'm on holiday. The mere fact I've managed to go on holiday in itself is a minor miracle. And I'm generally going out for 2 to 3 hours a day, and that's as much as I can stand. I can't go to the beach, even I'll show you again, I've got some different moisture chamber glasses. So these, I've got little silicone cups on, which keep the wind out. I'm very myopic, so it depends. I have to be slightly careful of which you get because you'll fit prescription lenses. I sitting in the garden of our holiday let because my husband's gone out because I can't, because I went out this morning and that was enough for me. So it does impact everything you do, and I'm very much in that process of adjusting to my new normal. As I see it, I have 2 choices: I either get on with it or I don't. And don't obviously isn't an option. I can't, lie in my bed forever. So I do need to adapt, but it's incredibly difficult. And certainly from a personal perspective, the Dry Eye Foundation have been brilliant at kind of helping me come out the other side of what was a fairly dark place.
Awesome. Christina, anything you want to add to this, or we can go on to the next?
No, I think all of you more or less speak to this similar experiences I've had. I come back to what Amanda said. It's your eyes. It's impossible to get away from them, to not think about them, because they're in your head, in front of your brain. So I think probably in all the stories everyone has shared, or all the experiences everyone shared, it impacts everything, because you use your eyes to see and interpret the world. So I think we've touched on that. This next question about the psychological impacts, I think that plays a huge role because it is all consuming and it's impossible not to think about it. But yeah, well, we can move on to the next question.
So I can go.
Yes.
My name is Adrián and I Spanish, but I am based in Paris. I was extremely happy to learn your stories, to listen to you today, to reach your website and see the stories, because there is one thing that you repeat all the time, that is pain. And in fact, this is the focus of my PhD, and I'm trying to understand the pain in the patient, and also I'm trying to test some drugs in animal models. So thank you, because listen to you is like, okay, the work you are doing every day, it will serve for anybody. So this is to start, and then my question is, as she said, that something had to be happening in the brain. So there is any psychological impact in your in your life, in your psychological life, and it's a small one, it's a big one.
I wanted to say something about pain first, and then all of us, I think, have lots to say about the psychological impact of dry eye. Pain is a word that doesn't, in a lot of the history of our dry eye community, it just doesn't come naturally to us as a description for what we're experiencing. I think we need to use the word pain more in order to get the help that we need, and in order to engage the professionals in this topic. I think we have all these different symptoms, and we're all different, right? For one person, it's more kind of a burning sensation. For one person, it's a foreign body sensation. For someone, it might be extreme light sensitivity. For someone, it's more about the way their vision is affected. When we first get to the doctor to get some help for dry eye, it gets labeled dry eye. And we come to associate the term dry or dry eye or dryness with the symptoms that we're experiencing. So when we go back to that doctor or the next doctor or the next doctor, because we usually do go through many doctors trying to get help, we say, my eyes are just so dry. And then that holds us back because the doctor looking through the slit lamp might not agree that our eyes are that dry, but it's the term that we've learned to describe our symptoms with. And I feel personally that we need, as a community, to embrace the word pain, because all of these symptoms are forms of pain. It's a legitimate word to use for it, and it's something that we can communicate our needs better through that. So next, on the psychological side, I just want to throw out a few numbers, and then I'll hand it to the group to talk about. In the survey that I talked about that we've been conducting, like I said, we haven't really analyzed all the data, but I have simple numbers on the mental health side of it. This is 480 patients that took a very lengthy survey about their experiences with dry eye disease. And of those, 63% reported experiencing anxiety because of dry eye, 51% reported experiencing depression because of dry eye, and 15% reported experiencing suicidal ideation because of dry eye. So yes, we have a big psychological impact from dry eye. Christina, you want to jump into this first?
Yeah, thank you. Oh, go ahead. Okay. So something that comes up a lot in these like weekly dry eye happy hours that Rebecca and the Dry Eye Foundation host, as well as in our Facebook group, are the words chronic and progressive. For many of us, and I don't know about the students that are on this call, you know, how you've learned how to describe dry eye and its long-term impact. But for many of us patients, the journey, at some point in the journey of diagnosis and all of that, we get told that our condition is chronic and progressive. For me, that was the day I was diagnosed. I got MGD, the first ophthalmologist I saw, that was the diagnosis. And then, you know, they explain what that means, and then it's chronic and progressive. Oh, and then by the way, here's a list of, 10 things that you should be doing every single day for the rest of your life. And so it's a lot for anyone, speaking from my personal experience, to have all of that information thrown at me within this 3-hour window of my life. I went from having these symptoms and not having any explanation for them to suddenly having this, what felt and is a life-changing diagnosis. And then those words, chronic and progressive, just sit with you and sit with you and sit with you, because the doctor, that's the clinical terminology, and they don't really do, at least in my case, there wasn't really any adequate follow-up to what that would mean. So I was left to my own interpretation. And so again, just based on my experience, and I'm learning to call it this, but I really felt that for me, post-diagnosis, it was traumatic, and that's a psychological impact. It was traumatic. I had panic attacks for several times a month. I would have panic attacks. I had some other stuff going on in my life, but I think that the diagnosis and not knowing what to do with the words chronic and progressive and what that meant for me played a huge part in my psychological well-being. I'm just hoping I can get to a point, as Amanda said, one of the tips for those of us in this situation is counseling. So I'm just hoping I can get to a point in my life where I can get the tools and strategies to more or less feel neutral about the pain that I'm in every day, but also make space for the days where I am feeling really bad, but then also having, again, strategies that I can go to that will actually help. But it's been years of just me trying to figure this out. I'm sure it's the case for many of us, is like figuring out what to do on our own, because there isn't that follow-up after the appointment as well. We talk about that sometimes too, is like the psychological piece of this diagnosis is ill-addressed or under-addressed by ophthalmologists and by other doctors who may be doing the diagnoses. So you have to figure out a lot of this on your own. So yeah, huge psychological effect. And again, it's your eyes and you're in pain. I think for all of us on this panel, we're in pain constantly. So, varying degrees, but more or less in pain all the time. So it's hard not to think about it, and that drives you crazy. So.
There's a word that came up there that I just want to pick up on, and that was traumatic. It's got to be really strange to people from the outside world who don't live in our world and don't understand this to imagine the word trauma in association with something like dry eye, right? But it's something I see over and over and constantly, especially when something's come on very suddenly, but in a lot of situations, I think the how long someone can go with uncontrolled eye pain probably has a lot to do with this. I know we don't fully understand it or anything, but for example, there's people I've known for like 15 years who went through a really super bad time with dry eye before they got the help and the tools and they stabilized and they got it the symptoms under control. They still got a problem, but it's under control. It's like background noise, like I was talking about. But then 10 years later, 15 years later, something happens where they get a bit worse. Maybe it's a particularly bad winter with the heat blasting. Maybe they've gone into menopause. Maybe they've changed jobs and in the new job, the air is drier in their office or something has made their symptoms worse. And they flat out panic because it brings back all those memories of how bad the pain was when it was at its worst. And they're afraid that they're headed back into that place. It's really hard to see it as just a flare up and I've got the tools and I'll get it back under control. Just an example, but I do think that trauma is something that our whole dry eye, or as I like to say it, ocular surface pain community deals with.
It's quite interesting. When I was in a very dark place, I accessed some free counselling from the British Medical Association because they provide it quickly with no wait time. And having spent an hour on the initial session, the words the therapist, who is clearly very astute, said was, "I've only got a few sessions with you, but I'm going to do some trauma counselling with you. I'm going to deal with you like you have had a traumatic experience through work." She's an NHS counsellor and does a lot of work for PTSD for people in the emergency services. So she has been dealing with it as if I had, you know, been involved in a major incident and experienced some sort of hideous trauma. And I didn't see it like that at all. It was her who picked up on it, and it's actually been really, really helpful. And she's one of the things she's dealing with me is the process of accepting that I have this diagnosis, and you know, trying not to look too far into the future and project either way. So not projecting that I'm going to be cured, which is really hard to deal with, but equally not projecting that, you know, in 20 years time I'm going to be sobbing in agony every day because my eyes hurt so much because it's progressed, you know, just sort of learning to accept the process as it is here and now. So I was really intrigued that she picked up on that. I guess the only thing I want to add regarding the psychological aspect, one of the things I found really difficult is this is essentially a hidden disability. If you go out wearing your sort of funky moisture chamber glasses, a few people might look at you a little bit strangely, but generally people don't look that hard and people don't tend to notice. And because I'm now, you know, pushing 50 and past the air of actually far past the idea of giving a damn what people think about how I look, I you know, it doesn't bother me wearing them. If it was 20 years ago, I'd have been very embarrassed. Now I just don't care. But you know, to all intents and purposes, if your eyes are not red, you know, to outwardly I look normal. And again, when you're trying to explain to your work colleagues why you've not been at work and they're having to pick up the work for you, you know, and you look normal, it's I think that's one of the hardest things, is it's a hidden disability, and people can't people find it difficult to put themselves in your shoes, and it's you know, if I turned up to work with a broken leg, I'd probably get more sympathy than saying, do you know what, my eyes just really hurt today. So I think that's the psychological impact, because people just don't understand.
Yeah, I want to go back just briefly to something Christina said, also the chronic and progressive language, and what a big deal this is to our community. This speaks again to the very first question, definition of dry eye, right? Because on the one hand, we've got disease, clinical signs. On the other hand, we've got symptoms. And these are two things that are only loosely related, right? So when doctors dole out this language of chronic and progressive, they're thinking in terms of disease. We patients hear that language and relate it entirely to our symptoms, though. It's how I feel today when, if my OSDI score is an 85 and my doctor's telling me, oh, and by the way, this is a chronic progressive disease, I'm scared witless, because what does that mean for my future? I'm going to feel this way the rest of my life? Really? It's going to get worse? What's this going to be like when I'm 60, 70, whatever? I don't want that picture. So there's this language disconnect there. And on I mentioned being involved with the TFOS DEWS II thing, when we had this entire day devoted to the definition of dry eye, right? The one thing where I got to have some say in that was I fought long and hard against the use of the word chronic, because they had that in their draft definition. And I said, you can't do that to us. You put that word in there, and then everyone who gets diagnosed with dry eye and goes and looks up what that means on the internet is staring in the face of this thing that's a lifelong sentence. No, please don't do that. So I was really happy that they at least left that word out. Mandy, anything you want to add?
I just want to stress a few of the words: the chronic and progressive, trauma, acceptance, and the future. And, you know, thinking about the future with this is just so hard. And I think Rebecca, Christina, Ruth, myself, you guys, with clearly what you're doing with your lives, are driven people who want to find a cure and don't want to be dealing with this. We've all, we're all really invested in our careers. We associate those with our identity. Having this happen is just from all of the other psychological aspects of not being able to go ride my bike how I want to because of the wind, thinking about what I need to do in the car because air vents, air conditioning, is there a fan? What's the HVAC system at like at work? Just all of these things that you constantly have to be thinking about, which in and of itself is a psychological component. The one thing I do want to add is about antidepressants and anti-anxiety meds. One of the things that is really associated with the medicine aspect is people think one of the side effects is, oh, it causes dry eye. And so many dry eye patients are afraid to try them or start them because of the dry eye side effect listed on many of them. And so I think that's in helping to treat that psychological component that does impact all of us significantly. That's a real barrier to treating it. I don't care. I'm like, whatever, I'm going to take these because, like I said, I would be a horrendous person. Some people think I'm horrendous as it is. So, like I would be a much more terrible person if I wasn't doing that, taking the meds. And so I try to tell people you should try them, but so many people just have it in their head that this is going to make my dry eye worse. And maybe it will for you, but maybe it'll help because it's helping to treat the psychological component, and it can help you not focus on it all day long. Like that's my problem. I get fixated and focus and think about it all the time. So thinking about meds, thanks, Christina. She just told me I wasn't horrendous. But back to the antidepressants as pharmacological, students, that's something to think about. I think, you're looking at treating dry eye disease in and of itself, getting something to help the psychological component. Of course, I want you to find like a cure for my dry eyes, but finding a way to have an antidepressant or something that doesn't have that side effect, or if there is a way to do that, could be useful.
I think that one of the issues we run into with antidepressants and dry eye is that our eye doctors themselves may be discouraging us from using these tools. I've talked to way too many people over the years who said, well, I wanted to try an antidepressant, but my doctor said it would make my eyes drier. I was like, okay, hold on. You're a whole person here. Your doctor is not a psychologist, and they're not an expert in psychotropic drugs. Let's have a little broader conversation here and see also figuring out this balance of what's, at this point, what's affecting me most, my eyes or my head, the impact that dry eye has had on me emotionally, mentally. Sometimes you've got to prioritize. And even if there is this, 3% risk of the drug making your symptoms worse or your signs worse, is it worth maybe taking that risk for the sake of getting the mental health side under better control? Because also when the mental health impact of dry eye spins out of control, that really sets us back. It keeps us from accessing the things that we need. We can't communicate effectively with our doctors when it's messing with us this way. We can't, it's a lot harder to be compliant with a treatment plan when your pain's out of control and your head's spinning from what it's doing to you, how much it's messing with you at work, or you're not sleeping through the night, or whatever. We have to be able to use these tools to get a balance. Okay, I think we're ready for the next one.
Yeah, so hello everyone, my name is Davide and I'm talking from Latvia. And the question is, so basically we know that dry eye disease can be driven from certain habits, like spending a long time in front of a screen or working and living in a dry environment. So do you think that there is something that has triggered, some habits that has triggered your dry eye disease? And in case, do you have any advice for especially young people or people in general that now with the pandemic we're spending so much time in front of a screen, and we know that spending time in front of a screen, our blinking rate drop of 1/3, and so we stimulate like evaporation of tear from our eye surface. And so yeah, do you think that there is something that trigger your disease, and do you have any advice for people?
So it's so complicated, really, because we've got causes of dry eye, right? And we've got contributing factors. We've got huge heterogeneity is the word that comes to mind for our dry eye community. We are so different, as we keep saying. We got dry eye coming from diseases. We got the autoimmune diseases and so forth. We've got it coming from lifestyle elements. We've got environmental factors. If I know somebody's living in Las Vegas, well, that's a piece of it. We've got iatrogenic dry eye, which is a huge one. TFOS DEWS II had an entire report on all the different drugs and surgeries and other medical interventions that are causing or exacerbating dry eye. We've got dry eye coming from unknown causes, like Mandy's case. So it's hard to generalize about anything, but we've got lots of specifics, I think, to share. Who'd like to jump in?
I can.
I mean, oh yeah, no.
Thanks, Ruth. I'll be quick here. For me, I see a direct correlation between my MGD and contact lens, what I call contact lens abuse. When I was in college, I would wear my contact lenses for a long time. I'm very embarrassed to disclose that information to all of you, but while we can't say for sure that was the cause, right? I do feel that that was the contributing factor. So I think my advice in this case is very simple. It's just proper contact lens wear, whether it's dailies or 30-day contact lenses. Just because it says 30 days does not mean you can wear them for 30 days straight. But I was a kid, so I didn't know any better. That's the way I rationalize it. So taking the contact lenses out every day and cleaning them and disposing of them properly when they've expired and all that. I think in retrospect too, the thought of putting a foreign object like a contact lens on your eye is kind of bizarre. I mean, I still wear dailies every once in a while for special occasions, but just wanted to share that anecdotally. I think in retrospect, I could deal with wearing glasses. It's not that big of a deal.
I mean, as alluded to earlier, I think my biggest of the contributing factors for me, some of them are fixed and I cannot change. One is, having 2 X chromosomes, and the other is probably hitting the perimenopause. I was thinking about your questions, and in case I forget to come on to it later in the one about sort of areas for research, I think the kind of hormonal aspect is probably under-researched. Without wishing to sound overly sort of radical feminist, I think postmenopausal women generally, there's not a huge amount of interest sort of necessarily in that group of patients, but certainly the fact that this came on so suddenly for me at a certain age when I'm female, I do think there must be a large hormonal component to dry eye if you look at the rates in women as opposed to men. The things that in my experience that I could have modified that would have made a difference as contributing factors, one would be working in an arid environment. Obviously, I've worked all my life in a hospital environment. I took my portable hygrometer into work and the humidity in my office was 35%, and that was with the humidifier running, which is pretty low. and obviously computer use and blink rate. And I have been told by my optometrist that I've got lazy. I'm lazy basically. I don't blink properly. I do partial blinks. So yeah, not surprisingly, my meibomian glands are unhappy. So in terms of things that could be changed, certainly education on how to use a computer healthily, you know, how to take regular breaks, how to do blink exercises properly, how to look after your eyes in the office environment with decent humidity. All of these things, I think there is a general lack of advice out there for people who work in the office environment, and that's certainly something I feel quite strongly about, because it is very easy to do it right, but most people do it very wrong, myself included. And had I think one of the questions we had in our sort of dry eye happy group, was a happy hour sort of group, was, you know, what would you do if you could go back in time? I'd go back in time and say, you know, please learn how to blink properly. Do it a lot. And there are various, there's a lovely sort of app you can get for your computer that tells you to blink, and hitches onto your computer camera and looks at your blink rate, which is slightly invasive, but I don't think they're, you know, recording me and selling my data. Just little things like that. It should be more widely used and encouraged.
Education on blink, I think boy, if there's anything I could wish for youngsters, especially, because all the screen use, and you can go on for years and have no clue about what that's doing. I mean, you're looking at a screen, you're fixating, you're not blinking, which means you're not secreting tears as often. And just the fact that your corneas are exposed that much more of the time, all those blinks add up, and they mean your eyes are undercover a lot of the day. You don't blink because you're staring, and they're just exposed. And the long-term impact of that, we just don't even really know or understand. Mandy?
I just want to say, Ruth, bring out the radical feminist. Here's my Supreme Court Justice, the only female Supreme Court Justice mugs. We've had my mug with the only Supreme Court justices that were female that we've had here. So I support the radical feminism. Go ahead. As for avoiding the disease, like for someone like me who has no idea what caused it, I don't know how you could give someone advice on how to avoid it if you don't know what caused it. But there are things that I should take my own advice on more, such as staring at a screen when you're very curious, and you spend all day staring at a screen, and then you want to like read a book or read the news. I've gotten really used to using audiobooks and listening to podcasts and listening to streaming news sources and things like that. So that's one piece of advice I would give to people. I would say that people should think long and hard about the side effects of different things that they're doing and using in their life. Like Christina said, the contacts. Ruth mentioned, you know, looking at humidity, looking at things like that, and the blinking, and Rebecca mentioned the blinking. But something that Ruth brought up yesterday in our phone call is like using retinoids, Accutane, you know, fake eyeliner, you know, lash extension things, all these things that you're putting around your eyes are very important. And so to really think about the long-term effects of those things, but like Christina said, when you're a kid, you're not thinking about those things. And so I don't know if there's a way to impress the importance of thinking about the things that you're doing now, how they may impact you later in life. Although I often always say too, I could go like get hit by a bus walking across the street right after this call, you know. So there's like this balance of doing it. I would also say, well, for those of you who don't have an issue with it, don't stop drinking alcohol. No, just kidding. Some people think that alcohol causes dry eye, and so they don't do that either, in addition to not taking antidepressants and meds. But I think that finding a way to relax whether it's, you know, going running, hiking, having a drink with friends, hanging out with friends, doing whatever you can to relax a bit is important too. If you do have this disease and trying to find a way to get out of your head, but avoiding it, I don't know if there's, I think until we know more about some of these causes, I don't know how we can avoid it, but there's ways to manage and deal with it once you do have it. But like for the screen time and the dry eye, I'm associated with screen time, there are ways to, yes, maybe avoid those effects of it, but a long-term diagnosis of dry eye with not knowing a cause, or even knowing the cause like Rebecca and not being able to go back and reverse it. These are things that I don't know how you tell people to avoid something. So I think it's managing it after you get to that point.
It's really hard when there's so many things that can have dry eye as a side effect. And I'm going to go back once more to the name of this thing and how we define it, because when somebody's facing the choice of whether I'm going to do this surgery or use this drug or something, and on the list of side effects is dry eye, well, big friggin' deal. It's dry eye, use some drops. How bad can it be? You can't assess that risk just from the word dry eye. It doesn't make sense. Mandy mentioned Accutane, you know, the acne medication. One of the most memorable young people in our online community when I first started the Dry Eye Zone was a young man who is an all-star football player at a university in Texas and planning to go to law school. Just a really great kid. Well, he took Accutane for 6 months because of severe acne, which, you know, is a legitimate thing to do. Acne can really mess with someone's life when it's severe. But it basically wrecked his meibomian glands, and he spent 3 years, I mean, pretty much 3 years lost out of his life from the massive impact of that, because he was in so much pain afterwards. And eventually, you know, he got more answers, he got some solutions and moved on. But just a devastating impact to somebody at a really exciting time of life who's really going places. Just to say, lack of information about risks that was true of me too. When I had LASIK, I thought I did all the prudent things. I grilled my surgeon. I had this long list of questions to ask, and my surgeon was the surgeon that fixes all the other bad surgeons' complicated cases and all that. So as far as I knew, I wasn't doing something risky, and I only, you know, found out later. But there wasn't a lot of published data back in those days. They didn't understand, and no one had ever even, we didn't even have language for things like neuropathic eye pain back then. All right, I think we're ready for the next question.
So I think that the next, Asif, would you like to make your question?
Yeah, sure. Yeah, thank you, Rebecca, for joining us today. And yeah, it was really nice to have you in our group and talking about the dry eye. As I am Asif Khan Sheto, and I'm a PhD candidate at the University Hospital in Cologne. I am more working on the technology part, nor the other colleagues in the group working on like pharmaceutical or biologist. I am more working on the computer side to develop some kind of algorithms or software for dry eye disease diagnosis. So my question is, are there any advantages of using some imaging modalities for dry eye disease diagnosis instead of some subjective clinical techniques such as fluorescence staining, shimmer test, or tear film breakup time from the patient point of view? Like the imaging modalities are more comfortable than the clinical settings or clinical diagnostic things?
Mm-hmm. It's a really good question. Speaking to the comfort side of it, the last time I let someone do a Schirmer test on me was 10 years ago. It hurts so bad, I'll never let someone do it again. And I think there are, you know, plenty of other ways for doctors to figure out whether I have a poor aqueous tear secretion rate, right? So yes, I think non-invasive is good. There's also the education side. I mean, pictures are educational, pictures are motivating. If they're explained well, if they're good images, they can help us to feel more in the know, more just understand what's going on, and get into better discussions with our doctors about what our treatment plan will be and why. And understanding the why of a treatment plan is really important to motivate someone to stick with it, especially when they're in pain and if the treatment doesn't seem to be helping immediately. I remember also being something that really helped me. This is like 15 years ago. I had confocal microscopy done in Boston at a time where there were not very many confocal microscopes in ophthalmology practices in the US back then. And they were able to show me the images of the different layers of my cornea and the tangled nerves and the mess that LASIK had left with me. And that really helped me just understand some parts of the pain of it that just, there wasn't a lot of information about that at the time. So it was good to see it. And it was validating too. It was like, I know I have a problem. Most doctors looking at my eyes don't think I have a problem on the dryness side at any rate, but to see there in black and white, literally, yep, you sure have a problem. That was helpful. I know meibomian gland imaging is being done a lot in the US now too, and that's being used a lot for education. Anybody else want to jump in on this one?
I'm always going to say a massive yes to imaging because I'm an imager. So the advantages I see for imaging, well, again, I'm hopefully going to have confocal microscopy at some point. There's very few places do it. My ophthalmologist works in a university teaching hospital, and the university have confocal microscopy. So I'm hoping to have that at some point to look at the nerves in my left eye, because I've had previous corneal abrasions. So I'm wondering whether the worst pain in this eye is from previous injury. So from that point of view, it would be useful to know, although it wouldn't exclude it, as these things don't. I think from my point of view, the advantage of imaging is it's more objective, less subjective. So let's take my meibomian glands. I have seen a variety of ophthalmology trainees, consultants, and several optometrists, and I've been told everything from I have significant meibomian gland disease to your lid margins look normal. They don't look normal. Even I, as a lay person, can tell they don't look normal. I've got a massive notch in one of them, and they've got telangiectasia on them. But having, I mean, meibography, as it's called, it's just, I think, from my understanding, using infrared setting on a slit lamp, but actually being able to image and grade your meibomian gland loss and take that into consideration with other objective measurements, i.e. number of telangiectasia, presence of where the line of marks is, etc., and coming up with an objective score is far more useful to give the patient just an idea of where they are. Does it alter the management? Probably not. Does it give you a means of following up whether treatment makes a difference? Probably. Again, looking at, I'm aqueous deficient because I know this because I've had a Schirmer test. Schirmer test obviously is a little bit sketchy. It's quite old technology, but mine is low, so it's probably right. But just even looking at the height of the tear film, I've been told your tear film is normal to your tear film is a bit low to your tear film is really low. Maybe using OCT, so it's optical coherence tomography, where you can measure the height of the tear meniscus and give you an actual a number to go on. I think in terms of diagnosis, when not all ophthalmologists are dry eye experts, having a set of diagnostic tools based on technology is got to be far better for the patient, because if I, as a reasonably educated medical person, can be given so many different diagnoses, when I challenge, when I've been challenging people, like, really, are you sure? you know, the average man in the street is going to be even more confused. So yes, to tech, please invent some some technologically driven diagnostic standards, because as working in medicine, I'm a fan of guidelines, I'm a fan of protocols, and I'm a fan of standards, because it gives like strength to the patient's journey. You know, that if everyone's being treated in a similar cohesive fashion, it just makes everybody's life a lot easier. So yeah, that's a little soapbox to jump on about that.
I think there's pluses and minuses to using the imaging modalities versus subjective, because like we were saying earlier, you know, things could look great, but your symptoms don't associate with that. That being said, I think that for someone like me who wants to fix something, wants to know exactly what's causing it, and I don't have an answer for that, seeing, like I've had lipid so I know what my meibomian glands look like. I've had doctors who have like imaging technology, so you can really see where the dry patches on your eye is, and does that correlate with where I'm feeling something, or does that not? And being able to compare those today to maybe 10 years down the road, 20 years down the road, and just being able to look at whether it's changed or not. Like I did just have a Schirmer's test last week, because I went into my doctor and we hadn't done one for years, and I have all of my my drainage ducts cauterized shut, and I still only produced like 3 millimeters in one eye compared to like what's normal, like 15, right? And then 4 millimeters in another eye, and that's with like everything closed. And so knowing though that it's not like 0, it was helpful for me mentally. Again, we're bringing in the mental, psychological component. I think that that imaging and long-term capability to compare things now to down the road might psychologically help people, or really hurt people if things get a lot worse. So
I'd like to also just touch on an ethical concern with some of the diagnostics. In the meibomian gland world, there's an entire industry of devices and procedures that are really lucrative. And in America, I feel that meibomian gland imaging is in a growing number of clinics used effectively to frighten patients into a lot of very expensive treatments. And that's a real concern for me. In the counseling side, I've talked to a lot of people who come away from an appointment where they had a lot of wonderful diagnostics done, and they're scared to death. They're like, oh, I've lost so many of my glands. I've got to just do everything possible. I'm going to mortgage my house and do all of these treatments because I can't afford to lose anymore because I'm in so much pain. That's not right. And it's not something that I'm imagining or paranoid about. I've been at industry events where they are teaching doctors to do this to a certain extent. They don't use that blatant language, but the effect is obvious. So that's, like I said, just my one negative on the imaging side. In other respects, I think there's just so many great ways it can be used. Did we miss the question from Maha? I think I had that earlier.
Correct.
Yeah, sorry.
Yeah. she's jumping now. Yeah.
I'm gonna ask you now. It's mainly about the COVID. First, hello everyone. My name is Maha, and I am based in Portugal. And it's very nice to get to know you all and listen to the talk. And I would like to ask you about how the COVID affected you as patients in general. Has it had some major effect, or was it minor, and in what ways generally? And thank you.
I had a heartbreaking conversation with someone last year who was taking steroid drops. That was the one thing that really helps them with their dry eye symptoms. And I learned during the conversation that it had been quite a while since they'd been examined. And obviously you've got to be monitored when you're on steroids, right? They were supposed to be tested regularly, but there was an appointment that they had that the clinic canceled because of COVID. And then no one set up another appointment. And so they went quite a long time without monitoring. And once I understood this on the phone call, I said, as soon as we get off this call, you need to call them and get an appointment set and get in there and be seen. And so a couple months later, I heard back from them, and they now have glaucoma on top of everything else that they're dealing with. So it's just, for me, that was just quite an example of lack of access to care during COVID has been costly for a lot of people. I've known a lot of people with canceled procedures, treatments, and just not being able to get what they needed in that time. I mean, thankfully, things have gotten back to normal in a lot of care situations fairly quickly, but there was pretty high cost last year.
I think some of it is still ongoing. It's the backlog. It's the backlog of cancelled appointments. So I mean, everywhere, obviously, we're all in different countries. We all have different healthcare systems. And obviously my experience in the UK is very different from my sort of American friends' experiences. So certainly in the NHS at the moment, the waiting time to get into a corneal clinic is 4 to 6 months. I was lucky. I was seen in a couple of weeks, but that is only because of the job I do. And there is obviously, when you are a senior doctor, a kind of unwritten rule that working in public health service is a bit rubbish. So one of the things we try and do for each other is see each other quickly. Had I not been in that very privileged position, I would have been waiting. I still would not have been seen unless I'd have paid for it privately. And I am able to afford to pay for it privately. A lot of people don't. But certainly I wanted to, one of my ophthalmologists referred me to the facial pain service, the chronic pain service, because one of the manifestations of my corneal neuropathy is I get it spreads over my face, so it spreads in the distribution of my trigeminal nerve, which is quite common, I believe, having read about it, and it really hurts, having that. So the wait time to see the facial pain specialist was 12 months. So again, I pay privately, because certainly if you are having neuropathic pain for 12 months, that is a heck of a long time to suffer. I would have, you can see why people with corneal neuropathy have suicidal ideation, because it has been excruciating on times. I mean, I'm on medication, I'm on pregabalin now, which is certainly helping, and sunglasses help, but having to wait 12 months would have been difficult. And again, so it's not just the pandemic, it's the knock-on effect of the pandemic. The other thing is mask wearing. Certainly having to wear a surgical mask in the hospital, I always again, coming back to the contribution, I can't wear one now, even with the moisture chamber glasses on. The sort of air going up over my eyes is excruciating. So I suspect there's an awful lot of people whose dry eye has been exacerbated by constant mask wearing, which is going to have made a lot of people's dry eye worse, I think.
Yeah, there's been studies published about that. Mask associated dry eye, things like that. Yeah.
I was just gonna piggyback off of what Ruth said and say, yeah, that was my experience. I mean, numerous times I would complain to my boyfriend after going to the grocery store, a 30-minute trip to the grocery store. I'm like, oh, my eyes hurt so much from blowing air into my eyes from wearing the mask. So anecdotally, I think that's probably pretty common for those of us with this condition, our pain being exacerbated.
So for me, I think that were you done, Christina? Sorry.
Oh yeah, sure. Go ahead.
No, go ahead. It just sounded like you were.
No, I did. I completed my sentence. Go ahead.
If you have more to say, go ahead. I don't want to cut you off.
Well, I'll just I mean, add to that again, I guess pandemic or not, I've been working from home for years, but anecdotally, I do feel like my symptoms have progressed. But then it's like, is that because this is a progressive condition, or is it because we've had even more time indoors and the mask wearing? You know, I don't know, but I know that this community of panelists is aware that the beginning of this year in particular, the first couple months were excruciating. It was the worst pain I've been in. But hard to know if that's affiliated with any pandemic related, you know, issues or not. So.
Okay, are you done now? I don't. Okay. So for me, it's, as Christina said, like she's been working from home. I haven't been working from home, but I stare at a computer all day long, whether I'm at home or not. You know, I mean, we have meetings here and there that break it up, but we have meetings here. And so they're on Zoom. I don't really, I mean, yeah, I'm looking at a screen, but it's different than staring at a screen and reading when you're on a call like this. I have actually found working from home has been awesome because I can sleep until like I think I got up at like 40 minutes before this call today, and I really am lazy about showering and getting ready like when I'm working from home, because why, you know? And so I find it's like so much better on my eyes. Like when I wake up, it doesn't matter what time I go to bed. If I wake up before 6, 7 a.m., my eyes just are horrible that whole day. And so being able to just sleep, roll out of bed, get on my computer, well, feed my dog, you know, get my coffee, has been great. And then I can take some breaks as I need to and get up and walk around, have the windows open, although I live in Wisconsin, in the northern part of the US. It's quite cold in the winter, but my dog gives me an excuse to go outside quite a bit. And so I try to get that fresh air as much as I can. And I also wear those awesome looking glasses. And so all day long, and I don't feel self-conscious around my family when I'm wearing them. So I don't have to think about that component of it. And I love it. If I can work from home forever, I would do it.
I was gonna say, I think the work from home is like key for people living with a condition like ours, because you can look however you want and not feel embarrassed. You know, you can, like for me personally, I'm a big believer in power naps. And so if I want to take a power nap at 2:30 in the afternoon on my couch to rest my eyes, I can do that. So I think there is, like, you know, the flip side of the pandemic, the positives for people like us who maybe weren't previously working from home like I had been. There are lots of benefits because you can take care of yourself on your own schedule and not have to worry about what people think about what you're doing.
I talked to a lot of teachers towards the beginning of the pandemic, and a lot of them were struggling terribly because they went from all in person to all screen, and they had to redo how they were thinking about teaching in general. Teaching online is just really different. So they had so many hours of computer work that they were really struggling. But then later on, many that I talked to seemed to be starting to experience those benefits of, I'm in an environment that I can control rather than a workplace with maybe a sketchy air distribution system. Some of the schools can be really hard places on dry eye. So it was interesting. It did change over time. One of the other pieces for me with the pandemic is just the mental health piece. Dry eye is already an isolating disease, an isolating experience. You don't know a lot of people in your neighborhood who are going through this, right? And then we get the pandemic, which is isolating. And so it's got this kind of amplifying effect. And I mean, that's why we ended up that's exactly what led to us starting the dry eye happy hour sessions on Zoom last year. Was, well, now at least everybody knows how to use Zoom, and we can start getting people connected and get out of the isolation.
I'm going to add to the isolation component. Actually, that part for me has also been great. I sound like this weirdo, but I have a hard time saying no to things. So I'm always doing things, and I'm putting others' feelings and thoughts, or what I think are other people's feelings and thoughts, ahead of my own. And so I'm not taking care of myself as much. So this has given me a reason to take care of myself. And it's a horrible reason. I know it's wreaked, havoc on the world and people's personal lives and losses. And but it has put me in, it's been a long enough period that I now understand what it's like to take care of myself a little bit, and probably going to give me the strength to say no, I think, in some of these other cases. And I have an awesome neighborhood. My neighborhood is great. I get along with everyone. We live in this like unique little pocket in Madison, Wisconsin, where it's like a really close old school type neighborhood. And so I don't feel I'm losing out on the social component. So that's I think a very different perspective than many people do on this.
I'm actually with you. I generally like my own company, so I actually quite like working from home. I'm deeply antisocial and deeply introverted, although I talk a lot. I'm a talkative introvert. I guess the other thing with COVID is stress, actually. Certainly, I think one of the contributors to my eyes falling off an absolute cliff at Christmas was stress related. Having worked, the hospital, I work in 2 hospitals. The hospital where I do the chest work is a tertiary respiratory hospital called Glenfield in Leicester, in the middle of the UK. So we are an ECMO, so extracorporeal membrane oxygenation centre, which basically is life support for your lungs. So we got the sickest of the sick COVID patients from all around the country transferred in, and their imaging was terrifying, let alone, when we would see the patients being wheeled through. So certainly stress, I think, was a major contributor to my dry eye, both in terms of not getting enough sleep, spending far too much time kind of doom scrolling through Twitter to see what a terrible job my government were making of managing COVID. So I shouldn't get political, not a fan of my government. Stress as well. If you're not sleeping, if you're not looking after yourself, it has a knock-on effect on your physical health as well. And certainly, everyone's found COVID stressful, whether they worked through it, whether they've lost loved ones. Just watching the news has been horrible. So I suspect that has exacerbated dry eye and many other physical conditions for a lot of people.
Absolutely. I'm looking at the time and realizing how many more questions we have left. So I'm
Yeah, correct. We are a bit running out of time. I don't know how can we. Yeah, I don't want you to take more time. Take more of your time than what was planned. But yeah, we can try to go ahead with the same approach. Just
we'll try to
speed up a little. Thank you, Anusha. I think you were gonna ask. Thank you.
Hi everyone, I'm Anusha. I'm based on University of Western Finland in Kuopio, and my question is how a dry eye disease patient like yourself were inspired to found this dry eye foundation itself.
Right, thank you for asking. So the Dry Eye Foundation as an organization didn't start until 2018, but it was really kind of the culmination of a lot of work I'd been doing for a long time. For me, it really started in 2005 when I started the Dry Eye Zone, and just didn't get around to kind of turning it into an actual organization until later. But to explain what led up to that, in the summer of 2001, I had LASIK eye surgery, and I didn't have any complications. Nothing went visibly wrong. It appeared to be a perfectly performed surgery, right? But my vision was really messed up in ways that glasses and contacts couldn't correct. And starting a few months after surgery, my eyes hurt all the time. And I couldn't get any answers from anyone. I couldn't even get doctors to talk to me meaningfully about this. I just got the brush off in every way. So I went online, but this was 20 years ago, and there just wasn't a lot online back then. But there was a forum, a discussion group for people with complications from laser eye surgeries, and I became part of that community. And as I started learning more about what some of the possibilities were and figuring out how to get hold of better information and find some solutions and all that, what struck me from the very beginning was just the level of life impact people were having. And again, this was laser surgery complications, but a large percentage of it was people with eye pain and people with dry eye. So that dominated a lot of the discussions. There were so many people that were just in so much distress, and a lot of suicidal people. And at that time, I mean, most of them couldn't even find doctors like me, doctors who would even listen to them. They were just told they were crazy and making this up. And going back to some of our earlier discussions, people were acting like they had PTSD. It was really something to see that there were so many people with a legitimate problem that felt like they were being left behind by the medical world and not being taken seriously at all when they clearly had a legitimate problem. At least that's how I saw it, because I was facing the same things. So really what inspired me personally was the emotional wreckage that these eye conditions were causing, and the sum total of the physical and emotional suffering people were going through. It just seemed unnecessary. I wondered, you know, who's going to help people? Clearly there needed to be people standing up and trying to advocate for better solutions and better support.
So Rebecca is the creator of the foundation, and I cannot tell her how grateful I am to her for starting this. This has been such a source of comfort for me to find other people that have this condition. And so I'm glad that she is driven and took the initiative to do this. And I can't tell you how many people she has helped and how much time she puts into this work, and she doesn't give herself enough credit, so I'm going to do it. And she is just fabulous, and fabulous for starting this, and can't be more grateful to her. It's a group that there are many other support groups out there, but Rebecca's, I feel, and those that I have experienced and come across, is the most, I guess, educated, knowledgeable, supportive, positive group in helping people out there. And she does a really good job of making sure we focus on helping one another and not as much on the negatives, and really reaching out to and providing the support for those who are in their deepest and darkest places, to hopefully emerge from those places. So just wanted to say thanks.
Now I'm really embarrassed, but thank you. Something you said just at the end that just triggered these thoughts, that a big motivating factor was the extent of the negativity within the online communities. It's like, if somebody's having a hard time and they're looking for help and they go online and then they get into a community and everyone there is angry and scared, then, okay, you found this place where you can get information, but you're also getting more scared and more disturbed because it's all of a sudden, oh my God, I'm one of them. And what does this mean? It's terrifying. So to me, to find ways to create a more positive environment somehow, that's actually what brought me into kind of narrowing down my advocacy interest to dry eye specifically, because in the laser surgery complications world, we were all pretty angry and scared, right? But when I started focusing on dry eye and opening that up more broadly, there were people with dry eye that come from all different backgrounds, some of them from laser surgery, some of them from diseases they'd had all their lives. So there was a variety of perspectives and experiences and people at different stages in their journeys. And it, to me, that was a way to get more constructive conversations going, because we don't want to just hang out and commiserate about how hard this all is. We also want to get someplace. We want to find solutions. We want to support each other. We want to all help each other get to a better place of managing our disease. Okay, I think we're ready for next, unless you have any follow-up.
So yeah, thank you. I'm Alba. I'm based in Belgium, in Antwerp. And my question is like, yeah, we know that the age changing of the patients of dry eye, it's also changing. And I was wondering if you've seen an different age trend on the people that reach towards the foundation. And if, yeah, indeed, the younger people needs that support or that help from you.
Yeah, it's such a great question. It's funny because if we talk about the epidemiology, yes, dry eye is getting younger and younger, and that's a huge concern because there's just not enough work being done on prevention, right? But you're asking, as I understand it, you're asking about the age of the people who are reaching out for help, and if there's more younger people now. The interesting thing is, it's actually kind of the opposite. For me, it was younger people all along. And when I had LASIK, I was 32. And a lot of the people I was working with after that, I mean, people in their 20s and 30s, teenagers sometimes, especially the ones with the Accutane-related dry eye. But over the years, I feel like now more older people are reaching out, maybe partly because more older people are online now than was the case 20 years ago too. And I mean, for young people, it's natural. I got a problem, I go online, I research it. But 20 years ago, 15 years ago, that wasn't necessarily the case for older people. Also, just because we're more well-known now than we were back then. There's more doctors that send people to us. So they're sending people to us at a variety of ages. And I'm really happy to see more doctors knowing that for the part that they can't, I mean, they're there to address the medical part. They can't address all of the life problems that come along with dry eye. It excites me to see doctors becoming aware that there's some place that they can send people for some more help on other levels. Did that answer your question okay?
Sure.
Hello. So the next one is me. I'm Murat, based in Paris, and my question is concerning more Rebecca also. What activities do you organize to reach more people, especially young people, to inform them about the lifestyles, particularly provoking dry eye disease?
Right. So we're talking about raising awareness, and there's a few different levels that we see need for and are working to address, but kind of in a different order. So first and foremost, my personal priority has always been with the people that are struggling and are in a hard place, and trying to get help and information and support and resources to them. And I'll talk about kind of what we're doing to do that. Second, we also need to raise awareness amongst dry eye stakeholders, industry, pharmaceutical companies, researchers like yourselves, the doctors, the insurance companies even. We need them to understand our needs so that they can help us better. And then third, there's a broader awareness, prevention, like we've been talking about. How do we help ensure more young people don't get to a really bad place without even knowing that they can make some choices that would help to prevent this? So as an organization, we're super small and grassroots, and we can't do great, huge, giant things yet. This will grow organically, I believe. But some of the things that we're working on to power all of those things, one, first and foremost, is getting the data together about just basically documenting the problem. What really is going on? How can we, rather than being individual voices saying, here's my story, which is very important, but doesn't have equal punch in all circumstances, pulling together data about our experiences, I think, is the platform that will help us to reach into more directions for awareness. So I mentioned before, we've conducted this survey. It's kind of a giant survey, and it's left us with this huge, overwhelming database of 480 entries. There's about 600 line items on it, and it goes through every part of the dry eye patient's experience, from documenting their symptoms to all the different impacts on their quality of life and activities, to how they got dry eye in the first place and what some of the contributing factors are in their medical background, to what are all the treatments that they've tried and how have those worked for them, to what's been their experience with medical help, and then the financial impact of it as well. So we're at the stage of just kind of getting ready to analyze that data and work with partners to get different parts of it published, to say, here's what you don't know about dry eye, about our community, about how this came about and how it's affecting us. So I would say that's kind of a number one project, because to solve a problem, you got to understand it, and we need the data to do that. For support for people that are struggling or even just starting to ask questions, what we've kind of done from the beginning is online forums and groups. It started with our Dry Eye Talk forum 16 now years ago, and then now Facebook groups and things to get people connected. And last year, our Dry Eye Happy Hour program was the newest thing to work on trying to get people connected. This year, we're going to be working on some new variations on the Dry Eye Happy Hour theme to kind of propagate that and get more out there for more people. Then there's some things we're working on the technology side. I've got a meeting actually this afternoon with a young man who's into AI, and he's working with us to develop a chatbot to answer people's questions about, from all different perspectives and situations on dry eye, any of the types of topics that we've talked about today, and a whole lot more, as just an easy way to get quick but really meaningful and real life answers for people who, whether they're struggling to find the right kind of doctor, or how to manage at work, or how to talk to their employer, or how to get more support, or a long stream of just purely medical questions. What are all these treatments and things? So we're pretty excited about that. There's a library we're working on building that will be an extension of that. The chatbot will reach into that to bring resources to people who are kind of trying to research diagnostic and treatment questions, but not exclusively from a medical perspective, just the practical information people need to know when they're looking into all of that. I know there's things I'm forgetting here. I'll remember right afterwards, but those are some of our key projects.
Sorry.
Yeah, right.
As Rebecca mentioned, she has a lot of things on her plate and not a lot of resources to work with. And so I'm on the board with Rebecca of the foundation, and there are so many things we talk about wanting to do, and just the capability of being able to do everything we want to do is limited by money and employees, clearly. But we have a list of projects that we would like volunteers to help with, and we have great efforts like this where we're trying to reach out and raise more awareness to different people who can help with dry eye. And so she's doing the dry eye happy hours now, which are recorded and out on YouTube. So more people can watch those when they want to, or people can join the dry eye happy hour. I am working with a friend of mine who happens to be the marketing person for UW, University of Wisconsin Ophthalmology. So I'm working with her to speak at one of their morning meetings. They have these weekly Friday morning meetings where they have people come and talk to the residents, the physicians, the faculty. So I am going to hopefully be speaking at that about what the Dry Eye Foundation does, and then just from the patient perspective of someone with dry eye. So we're just really trying to reach out to as many people as we can to raise this awareness from the patient perspective. So
I won't belabor this point, but I would say my challenge to everyone who's on this call, all of you students, is if you felt that today's conversation resonated with you, is to check out these dry eye happy hour conversations and share it with 5 of your friends or even one of your friends. I think that can create that groundswell effect of generating the awareness that we need to continue to empower this community and find solutions.
Okay, thank you.
Hello, so I'm Agnese and I'm based in Antwerp in Belgium, and I wanted to ask if the foundation is actually collaborating with other foundations or action groups in the world that are advocating for dry eye disease in order to have a global impact for this.
And I have to say to that, no, but we want to. There's not all that much going on out there in terms of patient-run organizations specifically for dry eye. And I would love to be in more contact with those that are. One of the things I think that's been definitely pretty high priority for us is working with organizations that are advocating for people with specific diseases that are closely tied to dry eye or some of the worst forms of it. So for example, one of our, I think, poorest served groups within our community is people whose primary problem is exposure. Their lid's not closing. There's not enough help for that out there. There are some small advocacy organizations that are working on things for that. So talking about like facial palsies and even like acoustic neuroma patients who have a tumor removed, that's all great, but they've got this problem left of their lid not closing, and they can even get their corneas scarred or lose their vision. That's an area we're looking to work with more. So if you have ideas or groups to put in front of us, boy, I would be all ears. As Mandy said, we're kind of limited by time and resources. Last year was going to be our year to really start working with more volunteers, and then COVID hit and everyone's lives just kind of went topsy-turvy. So that's been something kind of still on the horizon here, hopefully for later on this year.
I think the very fact that I was participating in a dry eye happy hour the other week at about midnight UK time shows that there is no equivalent here. And I'm not aware of, don't know what's out there in the rest of mainland Europe, but there's certainly nothing similar here at all. And certainly in terms of dry eye treatment, I think the States is ahead of us here. And just sort of what pharmaceuticals are available that have gone via the FDA, far more than have gone via the EMA and the MRHC here. So I think there is, there's lots of products out there that we just don't have as much access to. And again, I think everything is a little bit further on across the Atlantic. So certainly, would I love to set up something similar in the UK? Yes. Am I in the right place to do it at the moment mentally and with my job? No. But it would be nice for the rest of Europe to catch up, I think.
Just triggered another thought about this. Ruth, one of the trends that I've seen over the years that I've been working in this area is, you remember we're talking about the word trauma earlier. There's a lot of people that have been through a bad place in dry eye and come out the other side. They're not cured, but they've gone on with their lives. It's not dominating their every thought. We need people who have come through this to be part of advocacy efforts, to reach back afterwards and become part of driving things forward. And we have some, I mean, there's people like Mandy who goes to amazing lengths working with people one-on-one that are in struggling places. And Christina too has been out there being super helpful. There are people doing this, but there are many more that can't, because the experience they've gone through has been so traumatizing that they just don't want to have to revisit that place in their life. I've heard that from so many people. I get calls from people like sometimes 5 or 10 years after I've had a first conversation with them, and they say, you know, I just want to let you know I'm in so much of a better place. And sometimes they're thank you calls, which is amazing. When I talk to them about the possibility of them participating in something, the answer is often, you know, I just can't face that. It's just too hard to revisit that terribly dark period of my life. And for this thing called dry eye, that shouldn't be the case. There's got to be ways that we can lessen the burden for people when they're first going through this.
I mean, one of my drivers, I suspect, is the certain degree of anger I have at how badly it's managed. So I was chatting to a medical friend about it, and I said, as soon as I'm able to use a computer properly again, I am going out there. I'm going to the Royal College of Ophthalmologists. I'm going to the Department of Health. I am emailing the heck out of people and saying, you need to consider finding a...
Oh no, I know connection was going to be potentially an issue for Ruth. Hopefully we'll get her back in a second here. Do you want to go ahead with the next question, and then we can circle back to Ruth if we need to? No.
Great.
Okay. I think I'm the next. I'm Nikos. I'm also working in this project in Valladolid in Spain, and the University of Valladolid. And my question would be, as my subject is related to the research of new treatment for the dry eye, how far we are, you think, from finding an effective therapy for this?
That's...
I apologize, I cut out, by the way. My my phone just had a little wobble, so sorry about that.
No worries. Thanks, Ruth. How far away are we? So once again, I'm going to go back to the first question, which was, what is dry eye in the first place? If it's this great big bucket of a lot of different things, then the answer is probably going to be different for different ones of them. I mean, if my main problem is my eyelids don't close, then the best dry eye drug in the world is probably not going to solve my problem. It may help, but while I've got that mechanical issue going on, a lot of the therapeutics just aren't going to be enough for it, right? Well, I don't know, we're always saying this, but we are all so different. I don't know how you get a generalized solution to something that is a broad definition. Once you start narrowing that, then you can get further. So that leads me to what I was saying before about ocular surface disease versus ocular surface pain. And I believe personally that in the therapeutics area, those that are going after drugs specifically targeting ocular surface pain are going to do more for our community almost than anything else, because that's the thing that is messing with us so much. That's the thing that drives us from one doctor to another. It's all about the pain in whatever, you know, shape or form that takes for individuals. So yeah, my answer to that is just, we don't know until we're more specific with it. There are some good things in the works. I know Novartis has got an ocular surface pain drug in the pipeline. There's a couple other things out there. I don't think we're that far away from finding something that is going to help with the pain side. And what I'm really looking forward to is once there's one thing that is specifically targeting that and has some I'm going to sound a little cynical here, but once it's got some commercial success, everyone else is going to pile in. So that's what happened when Restasis was approved in the US back in 2002. All of a sudden there's an entire industry because all of a sudden the business world realized, whoa, dry eye is a thing? It's a problem? We didn't even know that, right? So that's my answer. Ruth, you might have thoughts on this one too.
Yeah, I've got a wish list, so please go out and invent the following. Firstly, a topical treatment for ocular surface pain that numbs the corneal nerves to a degree, but not dangerously so you won't tell if you've got a piece of grit in your eye. Because certainly treating corneal neuropathic pain at the moment, you're either reliant on cutting off supply of the eye environment to the cornea through scleral lenses or bandage contact lenses, or you're relying on systemic neuropathic drugs such as pregabalin, duloxetine, gabapentin. Tricyclic antidepressants are problematic because they genuinely do really dry and you have anticholinergic effects to dry your eyes out. So that would be my wish list number one. My wish list number two would be a great anti-inflammatory drug that isn't going to give you cataracts or put your intraocular pressures up like steroids, but equally doesn't take as long to work as cyclosporin. And cyclosporin stings, man, it really stings. I've just got to 14 weeks on it and it still stings. Whether that be a anti-inflammatory, non-steroidal anti-inflammatory drug like cyclosporin, or be it biologics, because obviously, there is autologous serum, very hard to get in my country. Platelet-rich plasma is used elsewhere, not used here, and various biologic agents are out there, very little randomized controlled trial evidence for them. So that would be my number two wish list. Number three will be looking, because I was alluded to earlier, having thought about it and thought about the fact that so many middle-aged women get dry eye, hormonal. There's the great paradox of HRT. You would think HRT would make dry eye work better because obviously postmenopausal women seem to get it more, but HRT makes it worse. Why? I don't know. I can't quite find the answer looking online. So I suspect it's possibly testosterone rather than estrogens and progesterones. I don't know. But again, is there a hormonal solution to this huge cohort of older women who have dry eye? So yeah, so if you clever guys could go and invent those things, then that would be lovely. Thank you.
Awesome. And we've got our last question.
Yes, so I'll go with the last question. I'm Camilla and I'm a PhD based in Antwerp. And mine is...
You're mute, Camilla, I think, yeah? Suddenly.
Now it's fine?
Yes.
Okay. So I was saying that I have a really naive question. So just if you have any advice for us, that in the end we are a group of researchers aiming to find a new therapeutic approach for curing dry eye.
All right. I think we all need to weigh in on this, right? Christina, you got thoughts there?
I'll let you guys go first.
I'll just say, in addition, I mean, of course, I want a cure for my dry eye. I want you guys to figure out how I can produce more tears. But I think one of the things I stressed before is maybe a drug that is an antidepressant, anti-anxiety, that doesn't have a dry eye side effect. So.
I think my main advice personally would be do more of exactly what you're doing right now, just listening to patients, right? We don't get listened to a whole lot. We've got a lot of people out there to help us based on their predetermined idea of what we need. And the truth is, in our world, you can't solve all of the dry eye problem just by coming up with a drug to improve the clinical signs of the disease, right? We've got that whole sign-symptom mismatch thing. You got to keep that separate in your heads, really. There are clinical signs and there are symptoms, and they are not closely correlated. That's a defining aspect of dry eye disease and the experience of people in our community. And I wanted to say, I'm just so impressed with all of you and very excited that there are people like you in the world that are working on this research and are interested in hearing from people like us.
And I was going to add to what you just said, Rebecca, is that there's, what's the word I'm looking for? Like there's so much nuance, I guess, in each individual person's experience with their pain, their relationship to their pain and what they're going through. So I think paying attention to that nuance is critical, as Rebecca said, just as you're doing today, carving out time to listen to us. You know, I think that there's a tendency, probably at least in the medical profession in the US, is speaking at patients and not with patients and their caregivers. But as I said, what I said earlier, when I was saying, like, I know better, you know, clinically and all of that, medically, I may not have, you know, med school behind me, but I am the person living with this. And so it's crucial to listen to the patient and what they're experiencing. And again, identifying the nuance and trying to address those small little details that you're hearing, trying to find solutions for those things rather than something that's general and a catch-all for all of dry eye disease, because I don't think that that's helping. Or if it is, it's only helping. We talk about that a lot in our group too, is the efficacy of some of these treatments, whether it's the eye drops or other things. And, you know, what are the percentages of how well they work for some people, not others? I don't know that, you know, let's say Restasis. I don't know what the numbers are, Rebecca, you might know, but I'm certain that it's not working for 90% of patients. I'm sure the number is much lower than that. So there's certainly room for improvement.
I think that what makes a lot of dry eye products successful is not that they have outstanding efficacy rates. The numbers are not great, right? It's that they provide one more step of hope that something will help. So we all try them. I mean, one of the things that came out of our community survey that's just incredible is the numbers, the sheer numbers of things that we will try to help. I'm looking forward to that data getting out there and published, because the lists are very, very, very long. We churn through stuff one after another because nothing helps enough. And at some point we find a combination of 4 things that helps more than anything else.
It's exactly what I was going to say. Research, research, research. We need data. We need randomized controlled trials. If you look at the data for some of the things we do to ourselves, so not pharmaceuticals, obviously, but intense pulse light, meibomian gland disease. I was alluding to it in a dry eye happy hour the other week. The evidence, the quality evidence for it is poor, but we all do it. I'm having IPL at the moment, even though I know the evidence for it is a little bit sketchy, just because I'm desperate that it might work. And we try these things and we try these various eye drops. And when you Google the ingredients of the eye drop and look at the trials, they're tiny kind of case studies of you know, 20 patients. And it's very difficult to therefore negotiate the evidence to sort of try and find things that you think might work, because there is just not great evidence for a lot of them, which is why I do think, yeah, this is a fantastic initiative, because the more evidence we have, the better informed we can be as patients when we're making choices about our own care.
It's so essential. The evidence based on so many things is very poor. I've worked as a consumer reviewer on Cochrane reviews for some dry eye therapeutics, and it's being part of that process is just astonishing, because they start with this huge number of studies and they boil them down to, you know, 3 that were actually any good. They can't aggregate the data from many studies on a particular therapeutic because there just aren't good enough ones. I went through the same thing when I was on the epidemiology team on the TFOS DEWS II, we had to take all these studies and narrow them down because the quality or the length of them or the methodology, there's just so many problems. We need really good evidence, and that evidence has got to also effectively incorporate symptoms, which again, to me, it always comes back to the symptoms and the pain, right? You can have all the evidence in the world about the Schirmer scores and the meibomian glands and all that, but you also have to measure, what is this actually doing to help people? After all that, did they feel better? So more sophisticated symptom surveys are pretty high up on my wish list.
But if you look at the European Medicines Authority's document when they reviewed a Curvis, there's actually an edit at the end that says, here is the list of the people who do not think we should license this product because the evidence for it working is not great from the trials that have been done so far. So there's actually a list of the named people who sit on the committee, presumably, who licensed it, who actively disagreed with it, which I found really, really interesting. They didn't think the benefits outweighed the risks, and put their name to say it. So that again, that is the only non-steroidal anti-inflammatory that's available in Europe, and so even the evidence for that was not great. And you contrast that with something like cardiology. In cardiology, it is so evidence-based, so evidence-driven that, you know, there's a trial for pretty much every drug or every intervention, you know, for PCI, for cardiac CT, for cardiac MR. There is a huge evidence base for everything, and that drives treatment. I guess it's easier to make objective measurements about what's working. You know, you either die or have a heart attack. That's quite easy to measure, whereas dry eye, there's even a lack of standardization of measurement, which was one of the problems with the Cochrane review for IPL, was a lack of standardization of what you were actually measuring to show whether it got better or not. So unless you have that standardized methodology, then you can't compare. And I think that's one of the problems in dry eye, is that heterogeneity of experience and measurement. I don't know how we fix that.
Yeah, I've worked with, I probably mentioned this to you, but I worked with there was a working group we had together a few years ago at the American Academy of Ophthalmology meeting. We met, it was about 10 people, and it was about, could we create, is kind of bringing in leaders in the field, could we create some standardized, agreed upon outcomes for dry eye studies, like 3, not that everybody has to do things the same, but that in future dry eye studies, everyone would do those 3 in addition to whatever else they were doing, so that we would be able to do meta-analysis on more studies and get better answers. I mean, this dry eye industry has been here, you know, growing up for the last 20 years. There's tons of studies out there. We should be in a position to do better analysis of the data, but we're not, because of the heterogeneity of the studies as well. So getting some standardized, agreed upon outcome measures that are incorporated in more studies, that would be a huge win. And I know I could go on forever with ideas and all this, but I'm looking at the clock and realizing you probably all want to head out as you're hitting the end of your day. I just thank you so very much for the opportunity to talk with you all. All of your questions have been fantastic. And it's just, I think it's very encouraging to us to engage with people who are interested in all of this.